In today's Health Watch, we're looking at a medical condition that affects a majority of women in the U.S. We're talking about fibroids, and July is Fibroid Awareness Month. Fibroids are tumors that grow in the wall of the uterus. Now, while most are non-cancerous, they can cause pain, prolonged heavy menstrual cycles, and in severe cases, anemia. A new poll finds that 53% of women diagnosed with the condition reported being offered a life-altering hysterectomy. There are other less invasive treatments, but only 20% were offered those options. We're joined now by Director of NYU Langone Center for Fibroid Care, Dr. Shirazian. Thank you for joining us. Kind of explain to us the impact and the effect of fibroids on that 50% or more that do have it.
Yeah. So fibroid disease is really debilitating for many, many women. Many women are symptomatic. They have anemia, heavy bleeding, pelvic pain, infertility, urinary frequency, pressure. And often they go undiagnosed, or even when they are diagnosed, they're really offered very minimal options, either hysterectomy or nothing in many places.
What are those other options, and why are hysterectomies, why have they been the way that doctors have turned?
Well, I just really think we need to reframe the conversation around fibroids. Women really should be asking if they're a candidate for all the types of options that we have, which include medical management, procedures like radiofrequency ablation and UAE, myomectomy, which means removal of the fibroids, or sometimes hysterectomy is a good choice. But really, it's a personalized plan for each individual woman.
What are the risks associated with a hysterectomy?
Well, in good hands, hysterectomy can be a very straightforward surgery for some, you know, and I think it can be really life-changing for those who are candidates. But many women in the U.S. want fertility, right?
Right.
So they have fibroids, but they're young, they're in their early reproductive years, and they want to get pregnant. In which case, obviously, hysterectomy is not a choice, UAE may not be a good choice, and there's a nuanced discussion that needs to happen between, you know, the woman and her provider.
So, doctor, when should you see a doctor if you determine that a heavy menstrual cycle is something that needs to be checked out?
Yes, so what I like to tell women is you don't have to suffer with heavy bleeding every month. A lot of women think it's just part of being a woman. Like, I should be in debilitating pain and I shouldn't be able to go to work. Those are red flags. If you can't go to work, if you can't go out with your friends, if you're nervous about too much bleeding when you go out, those can be red flags that something else is going on. And you should go to your doctor and get evaluated for fibroids.
They should be taken seriously, though, even though
100%.
many are non-cancerous. What are the risks, the more serious risks?
Yeah, well, I think anemia is a huge risk. Women go to the emergency department monthly for bleeding. You know, anemia can be life-threatening. You can pass out, you know, your heart can even stop from anemia. I mean, it really can be debilitating. So anemia is a huge risk, you know, and then there's all the other lifestyle risks like urinary frequency, pain, pressure, hiding a uterus that looks pregnant, you know, because you're nervous about what people will say and think. So we should be demanding more. There should be a nuanced conversation with doctors about what are all our options. You should lay out your life goals, for example, pregnancy or symptom relief, and really have a good conversation with your physician about it.
It's an important conversation. Thank you for joining us, Dr. Shirazian.
Thank you.